My name is Dr. Shams. I'm the principal dentist at Crossroads Dental Clinic, working here for the team of 4 doctors along with me. We can talk about veneers today to enlighten our patients to get more knowledge about veneers and to get the right direction to choose the best possible veneers for their teeth. If you talk about different types of veneer, we can categorize into 2 kinds. First of all, in the broad category, there's one is chairside veneers. The patient comes to our clinic, he wants to have a veneer, and suppose there's a time foundation, he's having a wedding tomorrow or engagement or some sort of function. He don't have much time. He's a tourist here in Dubai with us. So what we do, we can do composite veneers then and there. We clean their teeth properly, we polish their teeth properly, ask them to choose the shade, and if they want to go with the full mouth till the smile line, we can change the color of the teeth and we can change the shape of the teeth, and we can do within 2 to 3 hours of time at least 10 teeth up and 10 teeth down we can do to change the whole smile with a new color and a new shape. Well, if the patient is having time and the time is not a foundation and the patient is wants to go with the laboratory made, the second type of veneers is called laboratory made, where we use zirconia material to make a veneers, or the most commonly used material in veneers with the laboratory made veneers are lithium disilicate, the commonly known as IMAX veneers. Those are the mostly, if you say veneers, 90% of the time the doctors use to go with this one. Once it is fitted on the tooth surface, it is amazingly strong, amazingly shining, bright. You can change the color. We design the patient's new teeth on the patient's teeth model with the help of wax, the longer, the shorter, the broader, whatever the shape and size we want, we can show it to the patient before, and then we can go for the making it in the laboratory. So here we have a good amount of control over what shape we want. Somebody's face is round, we cannot use the longer veneers. The length and the breadth ratio is different. Somebody has a long face, V-shaped face, the shape of the veneers will be different. So before going for the final veneer preparation in the lab, what we get is a trying kind of material, like a wax model, where the laboratory has designed a wax veneer, which we take the impressions of this, make a negative of it, and place in patient mouth to show them that this is how your teeth veneers are going to look like in terms of shape, and mostly in terms of color as well, because the temporary materials, we have got different colors. So we choose, suppose somebody has a very darker shade, we call it A3 shade or A4 shade, we can use the A1 shade of temporary material, so enhance the enhancement the patient can feel before going for the final laboratory veneers. So that encourages them to get an idea of what he's going to get in the future. And laboratory veneers, it takes 4 to 5 days of time if it is a 20 teeth. Most commonly in our social media today, the Hollywood smile is a very common term, but basically that's nothing. It's nothing but full mouth veneers, we call it, to change the shape and color of the teeth. Lumineers is a company which, as far as I know, they use a very patented material called Serenade, which they use very thin film kind of thing. The hardly thickness of the lumineer is 0.4 to 0.5 millimeters, or sometimes in cases 0.35 millimeters also. They have used it to glue the tooth surface with the veneer, and that becomes a very strong thing. So they are the pioneers of making non-prep veneers. So we don't need to cut off the tooth. The thickness of the veneers is so thin that even if you place it, the tooth doesn't look out or the lip doesn't feel anything. It's so thin. Benefits of the chairside veneers, like in one appointment, in your first appointment, you can go out of the chair, out of the clinic with a beautiful smile. But it has certain disadvantages. It's very cost effective also. And of course, different doctor to doctor it varies. With the doctor with the more experience may charge you a little bit more. With doctor with less experience, startup doctors, they can charge less. But yes, it can be done. That's the best advantage of composite veneers, is that it can be done then and there. Secondly, the disadvantage of composite veneers is that you need regular polishing. Every 3 to 4 months you have to go get it polished and done. And if you are a smoker, if you have a habit of taking a lot of spices or colored foods, the stains pop very quickly, so you might have to land up in a dental clinic within 3 months of time for the polishing. Okay, and if you have the second disadvantage for the composite veneers, it might chip off. Like young kids, they have a habit of opening up the bottles with the teeth and all. Of course, it cannot take up so much of forces, so that's the disadvantage for me. Well, in the other side, when you choose to go with the preparation veneer or non-preparation veneer or your e.max or zirconia, they are the very strong materials. The shelf life, you say, the longevity of these veneers are far more than the composite veneers once stick properly. Once made properly and stick properly without any kind of air gap between the air bubble between the veneer and the tooth surface, it is supposed to last forever. Forever means I can guarantee 15-20 years of time if I have done a good job to my patients. The most beautifully done veneers, the best dentists, they do it. They will take care of these factors, that their veneers are not impinging their gums, the veneers are not short of the gum, and after placing the veneers, the patient is able to floss everywhere as if he is flossing the natural tooth. I always tell my colleagues here in my office that what has to be done has to be done. If alignment is required, we can mask the alignment with veneers to a certain extent, but why to mask something? You don't want to wear a new clothes without taking a shower. Right, so if I have to believe that the teeth has to be aligned properly and then I can enhance in terms of the color, let's go that way. But my teeth is twisted, I don't want to align it, I want to just cover it up with the enhanced, like nicely covered veneers, a nice color, that may be not a very good choice for me. If again I'm saying what has to be done has to be done. If the teeth has to be aligned properly and it has to be covered with the cosmetically enhancing of the color and the shape has to be done, that is the correct way.